Pumeza is HIV positive. She has received AZT, which has prevented her from infecting her baby during pregnancy. She is preparing a bottle for her baby since breastfeeding can pass on the virus to her healthy HIV-negative baby. She is one of the 7,000 women who have become involved in the Khayelitsha mother-to-child transmission prevention project.
Look, the program in Khayelitsha is a service that the Health Department in the Western Cape is offering.
My responsibilities basically is to ensure that medical services are provided in the community of Khayelitsha.
Instead of doing it throughout the province, we've opted to do it in one area and to get all the logistics and operational aspects of such a program right.
An epidemic is a disaster. The plane has crashed.
Within a couple of months, we will do an evaluation together with the National Department, and that will be fed into all the different projects throughout the country to help the National Department decide its future policy.
What we have calculated is that the direct costs you add to the program are for the drugs only. In some cases, the health work providers may be just imagining that there will be extra work. It's natural for workers to create those imaginations. But I think the workers on the ground, midwives, all of them across, have no problem. We just need somebody at national level to take a firm stand.
And we certainly would like to see a decision sooner rather than later. The mother-to-child transmission program in Khayelitsha has opened up the disease. Everybody talks about it. Women are all in a support group. We don't just kind of give them the drug and then leave them alone. Most of them have informed their partners, and the majority have actually been supported by their partners.
Usisi okhoyo phakathi kwethu uzobalisela ababantu bafikayo ukuthi yintoni AZT and yenze ntoni kuye.
Okay, ngethuba mina ndibhukisha eMedical Mapongwana. Ndiye ndaxelelwa ngokuba i-AZT ndiyifumana xa na 8 months. So ndiye ndayinikwa ke i-AZT xa na 8 months. So ndiye ndayifumana ke ndabeleka umntana wam aphume negative xa testwe na 9 months.
All the women coming to the antenatal consultation are told, look, we have a drug, AZT, because we use the protocol with AZT. We have a drug that can prevent the transmission, unfortunately not by 100%, but half of it. But we need to know whether you are positive or not. And what is amazing is that among the 7,000 women, almost 7,000 last year that came for antenatal consultation, 75% accepted to go for the test. Why did they accept? Test was already available before. Nobody would go for a test. Where would they go? There was nothing to win there. Now they accepted because they knew that it won't do any difference for them to go for a test, but at least for their baby, they could prevent the transmission.
What one of the things we learned is that we started thinking for the community too much, saying no, the community will fear stigma, the community will not disclose.
So quite because akusulelekanga umntana sonokwenza kuba usulelekile funeka ke ndingamongezi ngokunokwana because xa ndimncancisa ndiyamongeza.
In practice, the community was already waiting. They just were looking out for an opportunity where they can go and test. They were looking out for an opportunity to go to a midwife who will say, look, we have this service. As soon as we said we start, they just walked in. The mothers themselves started support groups.
We thought it was not really fair for those mothers, to go for a test, and after delivery, for the one who have been detected positive, to be left alone.
Ndicela ukubuza wethu mna sisi le AZT xa uyinikwa pha kuthiwa iyanceda iyayiphelisa le ntsholongwane.
AZT akuthiwa iyayiphelisa intsholongwane. Yenzela ngela thuba uzawubeleka ne uba usowunayo mos la ntsholongwane ibe sezantsi inganyuki ibe phezulu izinga layo yaqo ayincedi la AZT.
And we are committed to follow them, treat their opportunistic infection, which certainly, as we know, will prolong their life.
We underrate the public. They read a lot. People read a lot. People listen to radios. People listen to TV. The public is well educated. Nobody should say that they don't know. They know.
Ukhona umuntu oyaziyo iHIV ba yintoni na apha kuni nazi intoni ngeAZT niyayazi lonto niyayazi nivephi
mabona kude na kwi radio na la clinic.
We estimate that for every rand we spend on prevention of mother-to-child transmission, that we'll save something like 2.5 rand on reduced admissions to our hospitals.
So if you calculate, this means more than 500 children born positive each year, only here in Khayelitsha. Each year. With this program, we can prevent half of them. So we can save at least 250 children from a certain death. I think it's worth to do.
So I'm really looking for two decisions. One is a budget allocation from the provincial government, and two is a national policy decision before expanding the program.
MTCT or no MTCT, still you would have to counsel your mothers antenatally. Any good antenatal care, maternity service, would do all those things that we do in the MTCT. It's the will to add on the MTCT now in antenatal care. That's all.
Eating time! Look how she comes so quick. Good. To my baby. To my baby.